Treating your breast cancer almost always involves more than one doctor. And it's important because we all specialize in different things. We all work together as that comprehensive team. Some of the key individuals on that team might include a surgical oncologist or doctor who treats cancer with surgery, a radiation oncologist who treats cancer with therapeutic x-rays, a medical oncologist who treats cancer with medicine. You might also have a plastic surgeon. You may have a social worker, a navigator, a nurse, maybe even a clinical trials nurse. And you might have other members of that team as well, including therapists and nutritionists, because we want you to feel 100% supported during your cancer journey. It's important to do research and make sure that you have not only the place that gives you the best treatment available, but a place where you feel comfortable, where you feel partnered with. And that comes from doing a little bit of research. So it's okay to take some time and do research into the cancer programs, into the specialists, and make sure that you have what's a right fit for you, because it is very much a relationship with your cancer team. People like to say that cancer doesn't see color, but cancer impacts Black and Hispanic women differently. From diagnosis through treatment, through survivorship, there are differences in how women feel, how they may be treated. There can be bias in the healthcare system that doesn't always result in the latest and greatest treatment options. It's so important for women to make sure that they find a physician and find a center where they feel seen and where they feel heard. I hear stories of women who bring concerns to their doctors and they feel dismissed. I hear stories of women who feel that they are rushed through their treatments and through their appointments. And the statistics show that Black and Hispanic women are not always offered even the standard of care. It might not always be a provider that looks like you, that's the same race or the same gender. When less than 2% of the oncology workforce is, let's say, Black, the opportunity to find a provider who looks like you might not always be there. But I think it's just so important to make sure that you feel seen and heard, that you have an opportunity to ask questions and get important answers. And that doesn't always come from a first opinion. Sometimes you need a second opinion, and that's okay. And I think when you find that doctor and you find that nurse and you find that team, that's a really good fit.